Welcome to So What's It Actually About? I'm your host, Margie Mchechny, and I, along with my wide array of guests, hope to help you better understand and weather the wonderful world of actuarial science. Hello, and welcome to today's episode. I am joined by Veena, who is an assistant lecturer here at UCT. I'll give you a bit of a bio to her now, but funny enough, we went on a team building acro branch extravaganza last week, and I called her Veena the whole day, and she was too kind to be like, Margie, that's not my name. So her name is Veena, not Vienna, like your girl Margie just decided to name her. But thank you so much for being here.
Thank you for having me. It's lovely to be here.
Let me give you Veena's background and or her bio, and then we'll get into a discussion. So it says, Veena holds a BSc Actuarial Science degree from the University of Cape Town. Throughout her degree, she has tutored courses such as linear models, Markov processes and time series, advanced stochastic processes, financial maths, survival models, and strategic thinking. So there's basically nothing this girl can't do. She is currently doing her master's in public health, specializing in epidemiology, I hope I said that correctly, and biostatistics, and working as an assistant lecturer in the actuarial section at UCT. So fabulous. She's done all of the things. So firstly, let's just standard questions. Speak to why actuarial science, why UCT, and sort of that journey for you.
Okay, so looking back at me at 17, 18, I definitely had very little knowledge about the working world, especially with actuarial science. I think the first sort of interaction I had with the name actuarial science was, people were telling me it's this very difficult degree, challenging, and I was somewhat intrigued, so I started doing my own research at the start.
What
degree was, and eventually, of course, I was very limited to what I could find online.
Yes.
Oftentimes, the recurring theme was in terms of, quantifying the concept of risk and uncertainty. Which at the time I thought it was a genuinely cool concept, which I had no idea how to calculate it. But
the closest we get to that at school is what, some high level probability, probably.
Yeah.
I mean, some counting methods.
So very little exposure, but I think also there's the aspect of protecting people financially and that positive impact. So putting all those pieces together, I essentially took a leap of faith with AXI. I say leap of faith because in retrospect, I had very limited knowledge.
I know. I look back as well, and I'm like, good grief. Like, that was, you went in blind. I actually had someone ask me the one time, they were like, how is actual science different from normal science? And I was like, oh no, it's not actual science. It's actuarial science. It's a bit of a misnomer though, because it is a science to it, and yet it's not a science in that, like, you don't do experiments and like there isn't that form of like rigor. Well, there is rigor, but not that sort of scientific like lab work or anything like that. So I think people do find it difficult to wrap their heads around. But I also went in so blind.
Yeah, and I think it's kind of a process when you come to university, studying and being an actuarial student. You have to really trust the process because in the beginning, you're definitely going to be equipped with a whole set of tools that are really cool to learn, but oftentimes you don't know when and how you're going to use
it. Or where they fit in, right? And sometimes it seems like deeply theoretical, and you're like, how will this ever be practical? Like, where am I going to like transform the distribution kind of thing?
Yeah.
Still looking for that too. And I'm sure there are cases.
Every day, yeah. So I think inherently actuarial work, as you said, it's complex. It can't be described in a few sentences.
Yeah.
And, part of that is the reason why it's so powerful is because it's so complex.
Yeah.
And throughout undergrad, you're basically putting pieces of the puzzle together and slowly getting to that position.
Yeah. And then, so did you enjoy honors a bit more? They were honors / fourth year, more than your first 3 years because it sort of gave you more context? Or is it sort of like, I still have no idea what's going on?
I think what really helped in my honors year, in first year you do this course, you're probably not in a space where you can appreciate what is actually being taught. Because there's again a lot of uncertainty. And then you go on to financial mathematics, you start looking at annuities, it's starting to make sense. You bring in the concept of time value of money, and then you move on to models, and you're deeper in your statistical sort of knowledge at that stage. And then in fourth year, when you kind of put all those elements together, we did this one course called actuarial risk management, and it was, I think, one of the most helpful courses in terms of what I could expect to do as an actuary. We really gave a good feel of what a daily sort of task might look like.
Yes.
So
and the context of that, right?
Absolutely. And I think you needed all those other tools to be able to fully appreciate the content that's being taught.
Yeah.
So definitely it was a process. I'm still learning as you go.
I'm still learning, and I'm qualified actuary. I think that's one thing I like about actuarial science is there is that potential to continually learn.
And there's so many different opportunities and new spaces that you can be in, and then you find ways to apply your knowledge in that area, and that's like a whole different sort of ball game.
Yeah, and you find new ways of using that toolkit that you've built up that you didn't necessarily think about. And I think linked to that, we should maybe talk about what you're doing your master's in, because you're doing a master's in public health, which is that I mean, there are actuarial aspects to that because healthcare is a discipline within actuarial science, but why public health and why that sort of interest and emphasis for you?
Okay, so I think towards the end of my actuarial degree, I definitely was craving a broader perspective, and that was not restricted to actuarial science. I think with AXI, we are very quantitative, everything's very numbers and, profits. But with the MPH, it's allowed me to look at that same content in a different sort of perspective.
Yeah.
So with medicine, you're focused with an individual patient.
Yeah.
With public health, you're focused with a group of people and improving the health at, a group level. And it's not just looking at, health data. We do that in actuarial sciences, looking at health data. The MPH brings a perspective where you're trying to also improve the determinants of the data that you see.
Yes, it's not really saying, okay, after the fact, here's the data, and let's look at the trends, saying, okay, how can we impact that data so that we actually see trends that we want?
Yes. So that also involves looking at all the social and environmental psychosocial factors that, essentially are determinants of health. So when you look at actuarial science, you have that numerical side. Yeah. And then when you have MPH, you have that understanding of the context and, the goal to improve health at a community level.
Yeah.
It definitely has helped me in that space as well. And I think just being at the MPH program at UCT, and it's a completely different faculty.
Yeah.
So
it's a new faculty is that?
It's the health sciences faculty.
Okay.
Yeah, and what's been really exciting is being in a class with so many different academically diverse people.
Yes, you did.
Yes. So there would be lawyers and astrophysicists and doctors at the actuary on one roof, and that is so exciting.
The conversations you must have must be phenomenal because you get all these sort of very different perspectives on one sort of core problem.
Absolutely. You can just imagine the type of collaborative space that it creates, especially when you're all sitting there with the common purpose of improving health. So that in itself has been quite rewarding.
Yeah, I think what must also be interesting about that and useful about that is that's actually what you do as an actuary in the workplace.
Yeah.
I worked in product design for a while, and yes, I did the pricing and whatever.
Yeah.
But to implement a product, you need to work with the marketing team and the systems team and the ops team. And I think working collaboratively is not something that people often think about when they're doing, an annuity in FinMath.
Yeah.
But you never work in a silo, you are working in teams. And so
definitely
getting to grips with working with people who don't have the same emphasis as you and approach problems differently is really helpful. So I am very interested in this master's, might consider it myself. But your public health, the master's that you're doing, you're specializing in epidemiology, I think I said that correctly, and biostatistics.
Yes.
What are those two disciplines?
Okay, so within the MPH, you can do several tracks. So mine is epi and biostatistics. You can do community health or health economics, whatever your interest is. But with epidemiology, the focus is more on the causes and determinants of health-related states. So not restricted to diseases, right? So we're looking at the distributions, the frequencies of these diseases of interest, essentially. And with biostatistics, in the context of the MPH, a lot of the statistics that we are doing overlaps with what we saw in actuarial science.
Okay.
But The difference is that we're applying these statistical theories and concepts to public health research data.
Yes.
So understanding the health context, still the same statistical, we still do like regression.
Yes, the same sort of like toolkit.
Same toolkit, just in a different context. And the sort of overlap with epidemiology and biostatistics is to be able to effectively analyze determinants and distribution.
Yes.
You need statistical theory.
Yes.
So there is a sort of
that sort of overlap. Yeah, I hear you. That must be really, really interesting. And tell me, given that emphasis, are you still intending on qualifying as an actuary? And if so, is it health that is sort of like your secret?
Yes. So I am planning to specialize in the health area.
Okay.
I mean, ideally, I want to be in a place where I can continue to use my actuarial knowledge in whatever space I find myself in. Ideally, that would be in a healthcare space.
Yeah.
I think using what I'm learning in the MPH will also help me get a stronger sense of the context.
Very much so.
Especially with evaluating and improving public health policy. There's so much that actuarial knowledge can do to improve that, and understanding the context is so important and so beneficial. And so putting those two together will be a space that I would like to find myself in.
Yeah, I think it's also in the South African context, so much work that can be done there.
Yeah.
Right, because there's so much room for improvement, especially in the public health space.
Yeah.
So yeah, that's very deeply encouraging. But let's now move over to your role as an assistant lecturer, right? I know that you're an assistant lecturer for numerous courses, but the one I want to sort of focus on is the risk modeling/modeling one that you focus on. And at UCT, that's a third year subject, am I correct?
Yeah.
Can you just sort of talk to what does that sort of subject entail? I know that obviously it's a big board exam and it has many sort of, parts to it, and they split across the stats and outside department.
Yeah.
But what is sort of like the expansion and the focus of that subject as opposed to sort of earlier subjects, like FinMaths or LifeCon, that sort of thing, just so that our sort of listeners can sort of understand the difference?
Okay, so before that, we have the financial mathematics side of things where we're looking at the time value of money, and we're looking at payments in the future and accounting for time value of money. So you start looking at present values, future values, and so on and so forth. Yeah, right. And in third year, you're exposed to a lot of statistical theory. So you're looking very deep into distributions and the FTs of distributions and probability in general. And you use that statistical theory to bring an element of probability when evaluating future payments.
Yes. So basically not stripping out, but saying they're not as certain as you might have assumed in prior studies, that there's uncertainty that comes into that. And to model that uncertainty, you use statistics.
Yeah.
Okay.
So with modeling in general, I mean, you're trying to find this mathematical description of reality, right?
Yeah.
With the risk aspect of it, you're trying to find ways of getting that mathematical description such that you can manage and control risk.
Yes. And also understand, right? So just sort of be like, okay, this is how we anticipate it will play out.
Yes. So we kind of explored how we can use statistical theory and mathematical concepts that we already have to find those descriptions. In terms of survival analysis, we look at survival times. So that's essentially looking at the time until a certain event that
means some sort of time. Yeah.
Yeah. So what we explore in this subject in terms of survival analysis, we look at estimating survival functions.
Yeah.
So the Kaplan-Meier estimate, the Cox regression, if you want to look at.
I'm always been a long time since I've heard those words.
I'm also quite rusty, but these concepts are important when thinking about, especially in the insurance space.
Yeah.
When you're looking at future payments and you know that the future payments, whether it be premiums, it's not 100% certain.
Yeah.
So being able to understand the concept of, okay, what is the probability that a certain person will live up to a certain year? That's very important in pricing and reserving.
100%. So, because how much can we anticipate to get from them? How much should we set aside for them if they're going to claim? And that obviously those are core actuarial functions.
Definitely. And you carry that on to the next subject, 8213 contingencies.
Yes.
You kind of explore that in more detail.
Yeah.
Yeah.
Yeah. Which is, I think it's interesting because like in talking through these board exams with various sort of guests on the podcast, I think I've also understood the connection that much better. That sort of like you start with certainty and you get the students to understand like cash flows in a world of certainty and be like, actually, the world is not that certain. Like there's a lot of areas of uncertainty, and as actuaries, that's what we need to understand and try quantify. And the uncertainty comes from so many different realms, and